Hello, and welcome to another edition of From the Source, COVID-19 edition. I'm Elizabeth Johnson, your host, here to keep you abreast of the latest news and changes that have been occurring during the COVID-19 pandemic. As we close the month of May, Long Island region is still on pause. At present, the region has met 5 out of the 7 benchmarks necessary to step into phase 1 of reopening. Those businesses that are going to be the first to reopen should review the guidelines presented at the New York State website forward.newyork.gov to better understand and prepare their businesses as to what is needed to reopen. I had the opportunity to speak with Gail Hiller Lee, an insurance broker, on what advice she had for small business owners and what to consider upon reopening. Today I have the opportunity to speak with an insurance broker and all the changes that have affected businesses as well as individuals. I have with me today Gail Hiller Lee, an insurance broker. Welcome.
Hi, nice to meet you.
Yes. So tell us a little bit about your business and what you actually do.
So it's funny, we've been trying to explain this to the state, to the government, to anybody that will listen. An insurance broker basically works directly for their client.
Right.
We're responsible for finding products that will fit each employer's needs and their employees, coming up with contribution strategies, making sure the premiums are as low as possible. I always try to explain to my clients, although they all know now, I don't have many friends in the insurance business at the carrier level because I'm fighting with them all the time.
Okay.
But that's part of what we're supposed to do for our clients. It's almost 24/7. We make ourselves available to help with claims, to call doctors' offices, to make sure the administration is run properly, and nowadays to make sure that everybody's compliant.
Okay. Speaking of compliant, I know that the changes since March have been tremendous. And they come from all over the place. It's not just coming from New York State or it's from the Fed, it's from the IRS. Can you talk a little bit about what has transpired?
Sure. I think the biggest change has been using the word furlough.
Okay.
This is something that really, when you're looking at documents and reading contracts, it was something rarely spoken of, and now it seems that each carrier was coming up with the amount of time somebody could remain on a policy if their employee was furloughed, versus laid off, versus terminated, versus how long is your rehire provision. And although the state and the feds have come up with some guidance, really the insurance carriers at the beginning, before there was any guidance, had to come up with their own rules. Okay. And those rules were constantly in flux. So every day we were sending advisements about every carrier to every client, just so they could advise their employees properly. That's one of the first things. The other thing is the latest are COBRA extensions, HIPAA extensions, those changes, claim and appeal extensions. So, there are some employers that prefer not to know everything, but we're obligated to tell them everything.
I see. So is there a common definition of the word furlough now throughout the industry? Can you define it?
Well, it's the word furlough really it differentiates from an active employee and from a laid off employee and a terminated employee, whereas you're still considered an employee, whether or not you're working part-time or they don't have work for you. The way the insurance, at least the medical insurance, works is that as long as the employer and the employee are making the same contributions they did beforehand, they'll allow you to stay on. Now, stay on the plan, that has a definite timeline, and that's up to each carrier to determine and advise the client how long that timeline is.
Okay, so here we are in the midst of a pandemic, and depending on where you live, okay, especially in New York, because we're segregated by regions now, and so the Long Island region is different from the Mohawk region, which is now out from, or at least stepped out of pause. Um, the furlough, I guess, can be interpreted differently because here we are now extended into June, and we are not allowed to open. So would the carrier how would the carrier interpret that?
Well, right now, a lot of the carriers are extending through the end of September
Okay.
for the medical. So right now, they can sort of, hold that and not make any decisions. But there are other benefits where they don't extend that long. Like, for instance, group life. The disability policies, everybody really needs to stay vigilant and on the insurance carriers to make sure that they're advising their employees how long they can keep their benefits, or do they convert or port the coverage, especially in the group life. There may be somebody that needs that life insurance that would never consider porting it or converting it, but now because of a medical condition really needs to consider that. So the problem, I think, is that everything falls back on the broker to advise the client, and everything falls back on the employer to advise the employee. So I think, like, for instance, I'll give you an example. I've been sending out advisements to my clients about reopening
Right.
and hazards of reopening. And one of the biggest hazards is that although the government said that they were going to lay down some law, they haven't yet, about lawsuits.
Okay.
That really can work toward, a failure in notification for benefits. So it doesn't even necessarily mean getting back to the office and reopening and the hazards of doing that, but it also is in terms of not notifying the employee of their rights, like the COBRA rights extension.
Okay.
Very, very tricky. I have COBRA TPA, third-party administrators, that have not released any guidance at all. And we've kind of forced the issue with other TPAs. And every week we're saying, or actually right now it's every few days, you have to send something out. So the issue there is that normally if you're terminated, you could either go to the marketplace and get medical coverage at that point, or you can go under COBRA if you can afford the COBRA premiums.
Right.
But now they're saying that because money is very tight, especially if you've been laid off or terminated, they're going to give an extension to pay and an extension to elect. Well, how does the employer notify the employee of that? This is for groups 20 or more. And they're relying on their COBRA administrator to advise them so they can advise their employees, and it's sort of like a domino effect. So we're advising the client directly to notify the employees, even if your TPAs haven't started to, that there is an extension. But meanwhile, if you haven't paid or you haven't elected, you're considered terminated temporarily. So you don't have benefits. It's a very tricky situation. And I think conversation, communication is key when it comes to these changes in the laws.
Well, especially since a lot of the communication internally within a company usually happens through email. And once you're terminated or furloughed or whatever, you don't usually have access to that email. So therefore, they have to go into print and actually use the mail to do that. Is that correct?
That is correct, right. You can do email if you have the terminated employee's email address, and you can continue to send them emails. Just document everything and keep everything in a file and make sure it's received.
So you had to mention before about the businesses reopening. What are you advising your clients to do?
Well, I put out a 3-page document. It's really difficult to show you.
Right.
But
Okay.
it's also a mirror image, so it doesn't even, wouldn't even matter. But it's the EEOC, OSHA, ADA recommendations for reopening your office. And it's an article that I wrote that only scratches the surface, even 3 pages and it's scratching the surface. But basically, everybody is on their own along with the recommendations from the CDC. But we also put out a separate list that follow this of ideas on how to contemplate reopening. And I think the number one rule is listen to your employees, listen to their concerns. I think that is going to be key to making people feel comfortable. You can't over communicate. There's no such thing, not in this time. I mean, I can over communicate because my clients can't keep up with all of the rules and regulations. But when it comes to your employees, there's no such thing as over communicating. They want to know that you have their interest at heart before they jump into a situation that is sort of a tenuous, and dangerous potentially situation. So some of the things that we're advising, of course, is staggered work schedules. So you know that people who sit near each other are not going to be on top of each other. So if they're 6 to 10 feet away, that might make people feel a little bit more comfortable. Air purifiers or smokeless ashtrays, something that basically if somebody coughs or sneezes could be sucked up almost like smoke. It's something that hasn't been discussed yet, but I mean, the air purifiers and smokeless ashtrays have been around forever. So it might not be a bad idea to take that extra precaution and provide the employees with that. The other thing is, how do you have an employee re-enter the workplace? So one of the issues is, initially they were saying, well, take everybody's temperature. That's really not going to be the sole way to determine if somebody is healthy or not. So what do? Do you stagger entrance times by 10 minutes and say, this is your entrance time? You can stay in your car if you want, but this is your entrance time. You will sit with the HR person. First, you'll have a mask, you'll have gloves and hand sanitizer. And we'll sit in a room. We'll discuss, who do you live with? Has there been any issues with health? Have you been sick? Who have you been exposed to? Then if you want, you can have the temperature taken because that is a legal thing to do. And you can ask a personal question or two that would make everybody feel more comfortable before allowing them back into the office. I think it's not a bad idea, especially at the beginning, before there are set guidelines. If you're going to be doing this yourself and the onus is on you, you might even want the employee to sign something saying this has been discussed. It's not going to stop a lawsuit. God forbid somebody sneezes next to them and something happens. But there's also no way to prove that you got something that way. It's just an extra precaution to make everybody feel a little bit more comfortable. First aid kits. I'm just looking over at what I sent out. Get rid of your erasers and your chalk in your boardroom because you don't want anybody touching anything. Leave doors open. You can remove handles if you want. Knock before entering an office and wait for a response. More remote meetings, even if it's within the office, there's no reason why you can't do that. Wipes for electronics, because we all know that there's hand sanitizer, but everybody's touching the copier. So even if they have gloves on and then they wipe their eye with the glove or move their glasses like I just did, the lining of the eyes is also, an entry portal for this virus. So there's a lot to consider. I guess must-haves, gloves and masks. It's an absolute must. If you can't agree to it, then you can't come back to work. I mean, can you enforce these things? This is so difficult. Remove chairs in common areas so people can't sit down there. Discuss where you're going to eat your lunch. It's pretty much endless, but go through your typical day and think about how you would feel if somebody next to you was sick. And that potentially is anybody that enters your office. There's also documents I sent my employers for signatures for visitors before they enter your business.
Okay.
That's also something to consider. Who goes into your office and for what reasons? So there's a lot to consider.
Right. Especially if it's, I mean, you're talking about more of a business setting where there's actual offices and stuff. But what about those small businesses that are like dealing with people on a daily basis, whether it's a bakery or a restaurant or things of that nature? I mean, those are still considered essential services, but they do have employees and they do interact with the public.
Well, there's a deli down the block from us, and they have employees in the deli. They're all wearing masks, which is great. But they're handling food, and they're putting packages together. But there's a sign outside: "Do not enter the premises without a mask and gloves." They will not let you in. So, for the sake of the employees, I think restaurants, delis, any kind of food industry, even a service industry, I think they really have to spread their staff out. It's not going to be business as usual for a while until there's a cure, a vaccine, or better ways of handling this. But I think if you're going to have to limit who comes back into the premises and handles employees, customers, I think you're really going to have to make sure that everybody is just apart.
Yes.
Yeah.
Definitely. Now, is there any additional insurance that you would recommend, being that we're in an unusual time? Perhaps there's a new insurance that covers liability or whatever. I would think that people would want to make sure that they're well protected.
Well, for the employee benefits, which is what I handle a lot, a really quick story. When I met my husband, we were going to get married. I told him that I wouldn't marry him unless he had a long-term disability policy. Coming from an insurance person, but I said, I will not be able to support an entire family. If either of us are disabled, we need to have benefits coming in. So, aside of medical insurance, I always advise my employers, even if you don't want to pay for short-term disability policies or long-term disability policies, have a voluntary policy set up. Allow employees to choose whether or not they'd like to pay with post-tax dollars and get a pre-tax or a no-tax benefit if they can't work anymore. I think that anybody not offering this, I can't understand. I really can't understand, because the employer is not paying for it. It doesn't cost them anything. Aside of any other benefit, there are critical illness benefits that people have taken advantage of, hospital, accident. I don't generally recommend illness policies. If you have a good major medical policy, you should be covered fairly well. But these are indemnity policies that a lot of people like. I do like the cancer policy, but it's not all cancer. So, if I were going to recommend something to an employer, it would be disability. Because if somebody can't work and you have to let them go, who's going to pay their income? Who's going to pay their rent? Who's going to pay for their food? And the only thing that's going to do that long-term is long-term disability policy.
Interesting. So if you have a situation like, typically when you're married, one spouse usually carries the coverage rather than both. I mean, that's what I've experienced.
Yeah.
What happens with the change of status of one losing their job and the other one's keeping? Can they add, let's say they don't have the insurance policy currently. Can they get it during that time?
If there are two working spouses and they both have insurance offered to them and one has an involuntary termination, then they can jump on and enroll in the other person's insurance. If there's an involuntary loss of coverage, it's a qualifying event.
Okay.
So that's a protection in the law that's wonderful.
Yes, definitely. Definitely true. So what else can you recommend to the people out there?
I think stay on top of all situations regarding insurance and your employees. Reach out to your insurance broker. Make sure they're working for you, and you know, you're the most important person that they know. It's a communication between yourself, the insurance broker, and the insurance carrier, and your employees. It's really a partnership. Of course, your accountant is important. Your attorney, your legal attorney is important, but don't neglect the information that your insurance broker has for you. It may be somebody that you only think about when you're at renewal, but it's a 365 relationship. So make sure that you take advantage of that relationship, because every insurance broker that I know wants to help. Despite what people think about insurance brokers, like in Woody Allen movies or whatever, it's really not that way. It's really a group of dedicated professionals that have your best interests at heart.
Well, thank you very much for taking time out of your busy day. I know you're constant on these conference calls and everything. We appreciate your enlightenment, because it's a difficult time, and insurance is really critical at present. And always, I think.
Yeah, don't let this time fool you, because this goes on after the virus is long gone.
Yeah, that's true.
Yeah.
Thank you.
Thank you so much. Take care.
Bye. Elective surgery. The governor announced Tuesday that medical providers in Nassau County may resume elective surgeries and ambulatory care of patients other than those of COVID-19. Outdoor activities. Governor Andrew Cuomo also announced that the Belmont Stakes will be held on June 20th. However, there won't be fans in the stands. The stakes will be the first leg of the Triple Crown for the first time in history. Beaches in Nassau County are open. They'll be operating at 50% capacity with strict adherence to social distancing. Legislation has been approved to temporarily restrict the access to Nassau County beaches to Nassau County residents only. Most area beaches are doing the same. The town of North Hempstead is waiving the fee for the town of North Hempstead residents at their beaches. Golf courses in Nassau County are open. Please visit the local websites for more information regarding the setup, tee times, and relevant information. Social distancing rules are strictly enforced, and all golfers are asked to wear a mask. Tennis courts in Nassau County are open, but are restricted to singles play, mostly. Players are required to identify and supply tennis balls for their own individual use. Religious services. New York is allowing religious groups to resume having small gatherings, as well as drive-in and parking lot services, as the state continues to see a slowing spread of the coronavirus. Churches, synagogues, mosques, and more will be allowed to have gatherings of up to 10 people statewide. Strict social distancing measures will continue to be enforced, and all participants must wear a mask. Governor Cuomo announced the creation of an Interfaith Advisory Council that will discuss ways to bring back religious services safely. Low-income areas. Governor Andrew Cuomo has directed all local governments to test in low-income communities and develop outreach programs. Testing will be doubled at 44 churches in those areas, and the state is partnering with Somos Community Care to establish 28 testing sites at churches and community-based providers in predominantly minority neighborhoods. These areas will also be given more personal protective equipment and hand sanitizers, and officials will expand educational outreach efforts. COVID testing. The Food and Drug Administration has approved New York State to authorize the state's 28 public and private labs to begin manual, semi-automated, and automated testing for novel coronavirus or COVID-19. The approval allows the state to dramatically increase testing capacity to thousands of tests per day. The approval also extends to Roche high-volume platform for testing. Testing is free to all eligible New Yorkers as ordered by a health care provider or by calling the New York State COVID-19 hotline at 1-888-364-3065. There is a new, less intrusive test for COVID-19. The new test is done through a saliva sample and a self-administered short nasal swab in the presence of a healthcare professional. Additionally, healthcare professionals can self-administer the test without another healthcare professional present. That's all for now. Stay tuned to North Shore Television as we continue to bring the latest breaking news related to the COVID-19 pandemic. In the meantime, wear a mask, stay in place, social distance, and stay safe.